The Centers for Disease Control and Prevention, CDC, has issued an urgent warning about a dramatic surge in drug-resistant bacteria across the United States, including confirmed cases in South Carolina. These organisms, grimly dubbed nightmare bacteria, represent one of the most serious challenges facing modern medicine today. The specific threat comes from bacteria carrying NDM genes, a genetic element that enables these microorganisms to destroy carbapenem antibiotics, often considered our last line of defense against serious bacterial infections. The implications of this spread extend far beyond medical terminology and laboratory findings. As these resistant bacteria proliferate through healthcare facilities and potentially into communities, they threaten to undermine decades of medical progress, turning once treatable infections into life-threatening emergencies. Understanding the enemy. What are NDM-CRE bacteria? To grasp the severity of this threat, it's essential to understand what makes these bacteria so dangerous. CRE stands for carbapenem-resistant Enterobacterales, a group of bacteria that have developed resistance to carbapenem antibiotics. These antibiotics have historically served as powerful weapons against multidrug-resistant infections, often deployed when other treatments have failed. The NDM component refers to new deli-metallo-beta-lactamase, a gene that produces an enzyme capable of breaking down a broad range of antibiotics, including carbapenems. When bacteria acquire this gene, they become resistant to most available antibiotics, earning their ominous nightmare designation. What makes NDM particularly troublesome is its ability to spread between different types of bacteria through horizontal gene transfer, meaning that resistance can jump from one bacterial species to another. These bacteria cause various serious infections, including pneumonia, bloodstream infections, urinary tract infections, and wound infections. The CDC notes that NDM-CRE infections are associated with high rates of morbidity and mortality, with some studies suggesting mortality rates exceeding 40% for certain types of infections. The current landscape. A sharp rise in cases. The recent CDC report reveals a concerning acceleration in NDM-CRE detection across the United States. While these bacteria have historically been uncommon in the country, recent data shows a sharp increase in cases, with detection spreading to multiple states, including South Carolina. This geographic expansion suggests that containment efforts have been insufficient and that the bacteria are establishing themselves more firmly in American healthcare facilities. Dr. Maroya Walters, one of the CDC report's authors, emphasizes that this trend means common infections could become increasingly difficult to treat. While she notes that the risk to the general public remains low, the concentration of these infections in healthcare settings creates particular vulnerabilities for certain populations. The surge appears to be accelerating rather than plateauing, which has prompted infectious disease experts like David Weiss from Emory University to describe the situation as a grave danger and very worrisome. This assessment reflects not just current case numbers but the trajectory of spread and the limited tools available to combat these organisms. Why healthcare facilities are ground zero? Healthcare facilities have become the primary battleground in the fight against NDM-CRE. These settings create perfect conditions for resistant bacteria to thrive and spread. Patients in hospitals and long-term care facilities often have compromised immune systems, undergo invasive procedures, and receive frequent antibiotic treatments, all factors that increase vulnerability to resistant infections. The CDC identifies several high-risk populations within healthcare settings. Patients on ventilators face elevated risk because mechanical ventilation can introduce bacteria directly into the lungs. Those with urinary catheters are vulnerable to urinary tract infections that can spread to the bloodstream. Intravenous catheters provide another potential entry point for bacteria into the bloodstream. Additionally, patients with weakened immune systems, whether from disease, age, or medical treatments, have reduced ability to fight off infections naturally. The concentration of vulnerable patients, combined with the frequent use of antibiotics that can select for resistant organisms, makes healthcare facilities ideal environments for NDM-CRE transmission. Moreover, the movement of patients between facilities, from acute care hospitals to long-term care facilities, rehabilitation centers, and back, can spread resistant bacteria across entire healthcare networks. Transmission dynamics. How nightmare bacteria spread. Understanding transmission pathways is crucial for developing effective prevention strategies. NDM-CRE spreads primarily through person-to-person contact, most commonly via contaminated hands. Healthcare workers moving between patients without proper hand hygiene can inadvertently transport bacteria throughout a facility. Contaminated medical equipment and devices represent another significant transmission route. Inadequately sterilized endoscopes, ventilators, and other medical instruments can harbor bacteria and introduce them directly into sterile body sites. Environmental contamination also plays a role. Bacteria can survive on surfaces like bedrails, doorknobs, and medical equipment for extended periods. The CDC report also notes that while animals can carry CRE, the risk of transmission to pet owners remains low. However, this reservoir could potentially complicate control efforts in certain settings, particularly as the boundaries between human and veterinary medicine continue to blur. The bacteria can also spread through stool, which is particularly concerning in healthcare settings where patients may have diarrhea or require assistance with toileting. This highlights the importance of proper infection control practices around patient hygiene and waste management. Detection challenges. A critical weakness. One of the most significant obstacles in controlling NDM-CRE spread is the difficulty in detecting these organisms. The CDC report highlights that many laboratories lack the testing capacity to identify NDM-producing bacteria specifically. This detection gap has several serious consequences. Without rapid, accurate testing, healthcare providers may not realize they're dealing with NDM-CRE until treatment failures occur. This delay allows infections to worsen and provides more opportunity for transmission to other patients. Standard antibiotic susceptibility testing may show that an organism is resistant to carbapenems but won't necessarily identify the NDM mechanism, which has important implications for treatment selection and infection control measures. Danielle Rankin, an epidemiologist in CDC's Division of Healthcare Quality Promotion, emphasizes that selecting the right treatment has never been more complicated. Without access to appropriate testing, healthcare providers are essentially working blind, trying to treat serious infections without knowing exactly what they're fighting against. The lack of testing capacity also hampers surveillance efforts. We may be significantly underestimating the true prevalence of NDM-CRE if many cases go undetected. This makes it difficult to track spread patterns, identify outbreaks early, and implement targeted control measures. Treatment dilemmas. Limited options in a growing crisis. The treatment landscape for NDM-CRE infections is particularly challenging. With resistance to most available antibiotics, physicians have few effective options. The antibiotics that may still work often have significant toxicities or limited efficacy data. Some newer antibiotics show promise against certain CRE infections, but NDM-producing bacteria are often resistant even to these latest drugs. Healthcare providers must often resort to combination therapy, using multiple antibiotics simultaneously in hopes of achieving synergy. However, this approach lacks strong clinical evidence and increases the risk of adverse effects. In some cases, physicians may need to use older antibiotics that were previously abandoned due to toxicity concerns, weighing the risks of treatment against the certainty of an untreated infection. The CDC notes that because NDM-CRE has historically been uncommon in the United States, healthcare providers might not suspect it when treating patients with CRE infections. This knowledge gap can lead to initial treatment failures, during which time patients' conditions may deteriorate and transmission to others may occur. Root causes. Understanding the surge. While the CDC states that the specific reasons for the current surge remain unclear, several factors likely contribute to the increase in NDM-CRE cases. Gaps in infection control practices represent a primary concern. Despite established guidelines for hand hygiene, personal protective equipment use, and environmental cleaning, adherence to these practices varies significantly across healthcare facilities. The COVID-19 pandemic may have indirectly contributed to the problem. The overwhelming focus on coronavirus prevention, staffing shortages, and increased antibiotic use during the pandemic could have created conditions favorable for resistant bacteria to spread. Additionally, supply chain disruptions may have affected availability of testing supplies and infection control materials. International travel and medical tourism also play a role. NDM was first identified in a patient who had received medical care in India, and the gene remains more common in certain parts of the world. As global travel resumes post-pandemic, there may be increased introduction of NDM-CRE from endemic areas. The South Carolina Department of Health points to another crucial factor: inappropriate antibiotic use. Taking antibiotics when not needed or not following prescribed use contributes to resistance development. This includes both overprescription by healthcare providers and patient non-compliance with treatment regimens. Prevention strategies. Building stronger defenses. Controlling NDM-CRE spread requires a multifaceted approach combining robust infection control practices, improved detection capabilities, and antibiotic stewardship. Healthcare facilities must prioritize basic infection control measures, including rigorous hand hygiene, appropriate use of gloves and gowns during patient care, and thorough cleaning and disinfection of equipment and environments. The CDC emphasizes the need for enhanced laboratory capacity to detect NDM-CRE quickly and accurately. This includes not just equipment and reagents but also trained personnel who can perform and interpret sophisticated resistance testing. Facilities should also implement screening programs to identify colonized patients who may not show symptoms but can still transmit bacteria to others. Antibiotic stewardship programs play a crucial role in prevention. These programs work to ensure antibiotics are used only when necessary, at the right dose, for the right duration. By reducing unnecessary antibiotic use, we can slow the selection pressure that drives resistance development. Communication between healthcare facilities is essential. When patients transfer between facilities, information about colonization or infection with resistant organisms must accompany them. This allows receiving facilities to implement appropriate precautions immediately. Looking ahead, the path forward. The rise of NDM-CRE represents a critical juncture in our ongoing battle against antibiotic resistance. While the current situation is serious, it's not hopeless. Aggressive action now could prevent these bacteria from becoming endemic in American healthcare facilities. Investment in research and development of new antibiotics remains crucial, though we cannot rely solely on new drugs to solve this problem. Novel approaches, including bacteriophage therapy, antimicrobial peptides, and immunotherapies, deserve continued investigation. Equally important is research into rapid diagnostic methods that can quickly identify resistant organisms and guide treatment decisions. Healthcare facilities must treat infection control as a top priority, not an afterthought. This requires adequate staffing, training, and resources. It also demands a culture change where every healthcare worker understands their role in preventing transmission. Public health infrastructure needs strengthening to detect and respond to outbreaks quickly. This includes laboratory networks capable of sophisticated resistance testing and surveillance systems that can track resistance patterns in real time. Conclusion: a call for urgent action. The spread of NDM-CRE across the United States, including into South Carolina, represents a clear and present danger to public health. While the risk to the general public remains low for now, the concentration of these infections in healthcare facilities threatens society's most vulnerable members. The high mortality rates associated with these infections and the limited treatment options available make prevention absolutely critical. Success in controlling this threat will require coordinated action from healthcare providers, public health officials, researchers, and policymakers. Individual healthcare workers must commit to rigorous infection control practices. Healthcare facilities must invest in detection capabilities and infection prevention programs. Researchers must continue developing new treatments and diagnostic tools. And policymakers must ensure adequate resources are available to support these efforts. The nightmare bacteria label is not hyperbole. These organisms represent one of the most serious infectious disease threats we face. However, with prompt, coordinated action, we can still prevent this nightmare from becoming reality. The window for action is narrowing, but it remains open. The question is whether we will act with sufficient urgency and commitment to protect public health before it's too late.